Good morning, everyone, and thank you for joining the New England Nursing Home Quality Care Collaborative. My name is Janet Robinson with the New England QIN-QIO, and this is the CDI Initiative Accessing Your Data Reports from NHSN webinar. Before we begin today's program, I have a few housekeeping items to review. The first thing is I just want to let you know that around our building there has been some unexpected, very recent police activity. So I apologize if you do hear any sirens in the background. We did relocate to try to mitigate that problem, but I just thought I would let you know that up front. This webinar will be recorded and the presentation will be available within a few business days. The phone lines will be on mute for the duration of the presentation. We ask that you please do not put your line on hold. If you have a question at any point throughout the presentation, please enter it in the chat panel to the right of your screen. Please make sure to send your comments to all participants. Doreen from the QIN-QIO team in Connecticut will be monitoring and responding to questions or comments in chat. We'll also have plenty of time for questions at the end of the presentation, and we'll open the lines back up. Lastly, if you find that the presentation is a little cut off, please use the plus or minus icons in the top right of the presentation window to adjust your screen accordingly. Today's presentation is not focused on how the CDC and Medicare will use the data that you have so diligently been collecting as members of the CDI Initiative. Our main focus is to show you how to access and utilize the data for your facility. Jackie and I are pleased to be your guides as we talk about data validity and generating facility reports from the National Healthcare Safety Network. By sometime next year, I think you will actually be able to compare your facility data to the national baseline that the CDC will establish with aggregate data from nursing homes all around the country. Before we begin, take a look at your accomplishments so far. At the start of this project, the details around facility enrollment seemed overwhelming, and all the steps took longer than anyone imagined. We struggled with the SAMS process and the not always clear NHSN enrollment checklist. Now, the majority of facilities spend only 5 to 10 minutes each month doing data entry. If you have been following our weekly emails, 10 to 20 minutes a week of education has been offered, and we do hope that you've been taking advantage of the free CEUs associated with the 6 learning modules. Most facilities now have at least 6 to 8 months of data entered, and some facilities have 12 months. So now it's time to begin learning how to access and use that data. Similar to the beginning of this project, you may feel challenged. But just as you mastered enrollment and data entry, you will become proficient with utilizing the analysis functions available in NHSN. The next steps include learning how to validate the monthly data entries, locating the cumulative facility data, selecting relevant facility reports, and using that cumulative data so that you may inform policy and procedure in your facility. To assist you in taking those steps, today's presentation will review the monthly data definitions, describe how to generate data sets, identify the available reports, and describe how to generate facility reports. Some of the attendees today may be very new to the National Healthcare Safety Network, and the very quick review that I am about to do related to data may leave you with questions. If time does not allow for all questions to be addressed today, please put your name, contact information, and question in chat or on the evaluation, and your state CDI lead will follow up with you. Valid data begins with a monthly reporting plan, and that plan needs to be in place before the system will let you enter your data. The screenshot shows the NHSN page for adding the monthly plan. The only module required for this project is LabID event module, which is in the middle of the page. Do not check any boxes in the HAI and prevention process modules. The only organism required under specific organism type is C. difficile. The plan can be added each month just before you put your data in, or you can add it for up to 12 months within a calendar year. For example, if your facility completed NHSN enrollment in September of 2017, you can establish a monthly plan through December of 2017. You could also establish plans for January through August of 2017 and back enter your data. Always remember to click Save. The data to be entered falls into two categories: CDI LabID events and summary data. A reportable CDI LabID event is a positive lab test for Clostridium difficile obtained while a resident is receiving care in the long-term care facility and the resident has no prior C. difficile positive laboratory assay collected in the previous 14 days while receiving care in the long-term care facility. Another NHSN term for this is a non-duplicate LabID event. Please read the note that is on the slide. If a resident leaves your facility for less than 48 hours to go to the emergency room or for a doctor's visit, and while they are out for less than 48 hours, a C. diff test is done that is positive, that result would be considered a reportable event because the resident is still currently admitted to your facility. Other than this, lab results from outside facilities before a resident's admission should not be included. Also on the slide, you will see what's called a duplicate CDI LabID event, which would not be reported to NHSN. And this refers to a C. difficile positive laboratory test from the same resident following a previous positive test within the past 2 weeks or 14 days while in the facility. And I'm going to use this slide to just further clarify reportable and non-reportable. The examples on this slide all come from the same resident, and it all is a positive test. On October 1st, your resident has a positive CDI LabID event. That would be reported. This means that it's the first positive test ever for your resident, or it is the first positive test in 14 days. And you would fill out a form, and you would enter the information into NHSN. If, on October 6th, for some reason, another test is ordered and you get a positive result on that test, that would be a duplicate test. It's only been 5 days, and remember there's a 14-day rule in place. So that test would not be reported. The NHSN system will recognize that it has been less than 14 days and actually will not allow you to enter that result. But suppose on October 17th, you have another positive test for the same resident. This is also a duplicate. Now, it's been 16 days since October 1st, but you have to look back at the most recent test, which was on October 6th, and that has only been 11 days, so this would not be reported. Here's the tricky part where you have to be smarter than the NHSN system. The NHSN system will not recognize this one as a duplicate because the last test that NHSN has on record is from October 1st. If you are able to keep a log of your positive C. difficile test results with the dates, that will help you keep track of your duplicate test results. And even easier than that, of course, is be making sure that tests are not being ordered when they should not be. If this resident had a positive test on November 6th, that would be considered a reportable event. And remember that C. difficile testing is done only on liquid stool samples. Data entry for LabID events includes admission dates. This is used for determining length of stay, and it's also used when the NHSN classifies the event as either community onset, long-term care facility onset, or facility onset related to a recent transfer from acute care. So if you read the slide, the date of first admission is the date the resident first entered your facility. If a resident leaves the facility for more than 30 days and returns, you would give them a new admission date, and that would be the date they have returned after being gone for more than 30 days. And short and long stay definitions are determined from the date of first admission. There is another admission date, though, called the date of current admission. This is the most recent date that the resident entered the facility. If the resident has not left the facility for more than 2 calendar days, then the date of current admission will be the same as the date of first admission. And let me do an example for you. Your resident is admitted on September 1st. On September 8th, the resident goes to the hospital, but comes back to you the very next day, September 9th. That is less than 2 days. So even though they were there for an overnight, the first admission date remains September 1st, and the current admission date will also be September 1st. If the resident goes back to the hospital on September 20th, comes back to your facility on September 25th, now they have been gone for more than 2 days. So the first admission date will remain September 1st, but their current admission date will become September 25th. And the last example, if that patient that went to the hospital on September 20th does not come back to your facility until October 27th, that will change the first admission date from September 1st to October 27th, and that will make the current admission date also October 27th. This is what the page looks like in the National Healthcare Safety Network for adding an event. It is basically a duplication of the paper form that you hopefully completed when the test result was positive. When the information has been entered and saved, the screen will display an event ID number, which you can record and use later to find this event again if necessary. When you do have a positive test result, you can enter it. You don't have to wait until the end of the month or the beginning of the next month. You can enter it as soon as you have all of the information. Some facilities enter them as they happen. Some facilities, they choose to enter them all at once near the end of the month or at the beginning of the next month. Summary data is reported every month, even if you did not have any events for that month. A daily count is kept for each of the 3 categories you see on the screen, and then the total for each is recorded as the monthly summary data. So resident admissions means that for each day you record the number of admissions coming into your facility. You include readmissions when the resident has been out of the facility for more than 2 calendar days, and then you add up the numbers for the monthly total. For resident days, you record the number of residents present actually in the building. You do not include bed holds, and then you add up the numbers for a monthly total. The number of admissions on C. difficile treatment. For each day, you record the number of residents who rolled into your building already receiving Flagyl or vancomycin for Clostridium difficile that they had before they came to you. So they have arrived on treatment, and you would add up those numbers, and that is also going to be recorded as a monthly total on the summary data page. I'm stressing this because accuracy is very important. In particular, resident days is going to be used as the denominator to calculate infection rates. If you do not report these numbers accurately, you may end up with a rate to your facility which is either falsely high or falsely low. And here is a screenshot of the summary data page in NHSN. You will see that there are boxes for resident admissions, resident days, and the number of admissions on Clostridium difficile treatment. Note the Report No Events box on the far right. Forgetting to check this is a common error, and your data will not count if the box is not checked for the months when there are no positive tests. Now that I have addressed objective number 1, review the monthly data entry, I pass the ball to Jackie Haskell, Health Information Analyst for the C. difficile project.
PPP, I can give it to you. If you have,
Good morning, everyone. The next thing we'll look at is generating data sets. After entering your event data and ensuring that your summary data is accurate, the next step is to generate data sets. Until you complete this step, any recent changes to your data will not be shown in your report. This is an important step. This option is found under Analysis in the navigation bar that you can see on the left side of the screen.
it's always good because
This slide shows the Generate Dataset screen.
The leader has unmuted your line.
I have a people.
Sorry. Let's see. So at the bottom of the screen, you can see the Generate New button, the analysis data sets that reflect all data entered to date. And you may also notice next to that button, the screen also indicates the last date and time that data sets were generated. This is important to check and even to come back to if you're looking at reports and something doesn't seem to make sense.
Okay, then that's perfect. That's great. Okay, so just you have.
Next, we'll look at the available reports that you can access, including line listings of summary data and CDI events, as well as CDI rates that are calculated by NHSN. The line listing for summary data allows you to review your summary data by month, including a summary of months when a CDI LabID event occurred or did not. After selecting the line listing in NHSN, you can see on the screen here, you can click Run Report to run the report for all months that you have entered data. Or if you want to look at summary data for a more specific time period, you can click Modify Report. Here's some more detail on modifying the report. The Modify Report window has tabs at the top for customizing your report. In this screenshot, we are choosing to view data from May 2017 to September 2017. You can also choose which variables to display in the report, but here we'll look at the standard set of variables. When you've made your changes, at the bottom of the screen, click Run. And here is an example of a summary data report. So to give you an overview of just looking at the table, the columns show information on the time period, the summary YM column, numbers of days, such as number of resident days, number of resident admissions, and some information on your events. So looking at, and the table has one row for each month. Looking at the summary YM column, you can see each month. For example, the first row is for 2017 month 5, or May 2017, and the second row for 2017 month 6 for June, and so on. Two other important columns are the number of resident days and the number of resident admissions, because as Janet mentioned, these values are used to calculate your CDI rates, which we'll see in later slides. So now the summary data table also provides a quick look at CDI events and admissions. And so at the no events column that's circled there, we can see that the no events box was checked in the last 3 rows for July, August, and September, shown by a Y in the no events column. There were events reported in May and June, and so the events box was not checked in the first 2 rows. If this column is missing in any month, this indicates that the survey data for the month was not complete. In the last column on the right, the table also shows the number of admissions on C. difficile treatment during each month. This is different from the number of events that occurred in the facility. So if we look at the third row, we can see that there were no events reported in July because the no events box was checked, but there was 1 admission on C. difficile treatment. The next report is the line listing for CDI LabID event. This report provides details on each event and can be used as another data quality check. Again, you can run the report using the standard settings or modify it. Here we'll look at the full report and click Run Report. Line listing table has one row for each event and indicates when and where the event occurred. It also shows the event ID that is assigned after entering the event in NHSN. The report has key information for categorizing events. NHSN classifies events into categories such as community onset or long-term care facility onset based on the resident admission date, so that's the first circle column, and how recently they were transferred from an acute care facility in that last column.
No idea.
Just means no, and that means yes.
I have no idea. They're not
Excuse me, Jackie. Jackie, excuse me 1 minute. Hi, we're getting some background conversation. Can you please mute your individual line by pressing *6? Thank you. Go ahead, Jackie.
Sure. So this slide is showing the categories of event onset, so I'll go through what these are. The first row has community onset. In those cases, the specimen was collected within 3 calendar days after the current admission date. And the long-term care facility onset, abbreviated as LO, was more than 3 calendar days after the current admission date. And then there is also a subset of the long-term care facility onset events that were related to an acute care transfer. And those are the ones that occurred within 4 weeks after the last transfer from an acute care facility. So if we look more closely at the second row in the example report, we can see that the event occurred more than 3 days after the current admission date. So if we look in the event date column, it was event occurred on June 14th, and in the current admission date, the current admission was June 5th. So this was a long-term care facility onset event. In addition, since the resident was recently transferred from the acute care facility, which we can see in the last column for yes, then this is a long-term care facility onset event related to a recent transfer from acute care. When we get to the rate table reports and see the categories of events, if you're not sure why we're seeing, for example, a long-term care facility onset event, you can come back to the line listing for more details. The third report that we'll look at is the rate table report. And so the rate table will allow you to view the facility and CDI rates that are calculated in NHSN and how those events were categorized. When you run a rate table report, the window will show several types of tables. And so in the next few slides, I'll review the first 4 tables. And those are the total CDI rate, the CDI treatment prevalence on admission, and the total percent of CDI events that were community onset, long-term care facility onset, and related to acute care transfer. The other 3 tables that you can find in NHSN that I will not go through are the last 3 listed in gray on this slide. So all rate tables are set up similarly with a number of events, a denominator for a rate, and then the rate that was calculated. So the first table you'll see is the one shown here, the total CDI rate. So the number of events, total the CDI count column is the total CDI event. The denominator for the rate is the number of resident days, and then the calculated rate. NHSN calculates the total CDI rate per 10,000 resident days. So the CDI count divided by the number of resident days and multiplied by 10,000. And so notice that this is per 10,000 resident days, and you may be seeing rates per 100,000 resident days outside of NHSN. The next table is CDI treatment prevalence on admission. In this example, there were residents admitted on CDI treatment in May and July in the first and third rows. And so the CDI treatment prevalence is calculated as the number of residents admitted on Cedar-Vasile treatment divided by the number of resident admissions and multiplied by 100. For 100 resident admissions, it can also be interpreted as a percentage. So again, summary data is important since the rate is based on the total number of resident admissions. Another rate table shows the number of community onset events and the percent of total events that are community onset. So in this example, you can see in the second row that there was one community onset event in June. It was also the only CDI LabID event in the CDI count column, and so the community onset percent is 100%. Similarly, there is a table summarizing the number and rate of long-term care facility onset events, and those that are related to a transfer from an acute care facility.
I think we should talk to Kate.
So if we look at the first row, looking at the CDI count column, that's the total number of events, was 1 in that month. The next column, LO count, is 1, so that event was long-term care facility onset, and the percent LO in the next column is 100%. And the second to last column is that ACT LO count, looking at the acute care transfer related event, and this one, which is 0, which means that the event that occurred was not within the last 4 weeks of the transfer from the acute care facility. And the percent ACT LO is 0.
Yeah, it's very.
So in the presentation, we gave an overview of how to access and use the reports available in NHSN, but this slide also lists some more advanced analysis options, including the additional rate tables that were listed on earlier slides, further modifications to reports, including modifying the titles, the variables that are included, and filtering the data based on those variables, as well as group reports if you are part of a corporation and have access to data from multiple facilities. So if you're interested in knowing more about any of these options, please contact us and we'll be happy to go over this one-on-one. And now I'll turn it back over to Janet.
We would like to open up now for any questions that people may have. Doreen, has anyone put any questions in the chat?
No, there's nothing. You can press #6 to unmute your lines and ask a question over the phone, or you can enter your questions in chat, but remember to send it to all participants. So, Janet, we do have a question. For Marion, are we getting copies for this presentation? Yes, you will. In a couple of days, you'll be sent an email with the presentation included. You can also use the link that I put into chat to download today's presentation.
And while we're waiting for other questions, I do have a couple of common questions that I have received. One of them is related to whether something is an event or if it is an admission on Clostridium difficile treatment. So just another quick review. Event refers to a positive C. diff test that was done in your facility. That would be recorded on there's a paper event form where you can put all the data in, and then that information would be entered in NHSN under the tab Event, which is on the menu bar on the left when you're in the NHSN program. Admissions on C. diff treatment are not events. They're going to be recorded on the summary data page. And again, that refers to someone who has arrived at your facility already receiving treatment for Clostridium difficile, and their test was done somewhere other than at your facility before they arrived to you. The other common mistake, I'll say, that has happened on the monthly reporting plan, I've had a few facilities when they were entering their plan accidentally selecting a different organism other than Clostridium difficile, one of the other many bugs that starts with C. That's going to change what the monthly summary data page looks like, and it stalls people because you really cannot enter the data because you need the exact data page set up for Clostridium difficile. The good news is that if you make a mistake on your monthly reporting plan, or actually on just about any of the pages, you can always go back in and there is an edit option so that you can correct what might have been a broke on the computer or just a mistake that you made. So those are a couple of the common questions that I get. Do we have other questions?
Yes, I do. I see a question from Galena. They need a clarification on long-term care acute transfer counting the infection less than 4 weeks.
I would be happy to answer that question. And first let me say, you don't have to do in the facilities, you don't have to do any of these calculations. That's why it's so important to enter the correct admission dates and the correct dates of specimen collection. NHSN is going to categorize the events as events that happened within the first 3 days that the person was in the facility. That's called community onset. If it's after 3 days, it's considered facility onset, meaning the symptoms presented in the nursing home. But that third category, and I really think it's a very important one, acute long-term care onset, meaning the symptoms started in your facility, but the patient had been in the hospital within the past 4 weeks. So although the symptoms started in your facility, the actual incidence of C. diff maybe or probably is related to a recent stay in the hospital. And if that does not clarify it for you, put another question in and I will try again. Do we have any other questions? If some of this data information seems overwhelming to you, and it certainly has seemed overwhelming to me as I have done my best to learn it, please remember that you can contact your CDI, and if they are not able to answer the question, that's why we have Jackie, who is handling all of the NHSN data for us. So if we are not able to answer your question, we will either talk with Jackie or we will hook you up directly with Jackie. And I'm thinking particularly as you're hearing all that information about the reports, and you may not remember it all, Jackie would be able to help you in terms of what report, if you're unsure about what report it is that you're looking for. Excuse me. So don't hesitate to contact the person in your state, and then we'll go from there to make sure you get the information that you need. Excuse me.
Janet,
Before I go to any other questions? Yeah. Okay. So then I will go through the last few slides, and we'll do one more call for questions at the end. Please mark your calendars because we have a couple of upcoming events and educational opportunities related to Clostridium difficile. And you see them listed on the slide there, a 2-part webinar series on Clostridium difficile, which is going to cover preventing and managing Clostridium difficile. You can check out our website for more information, including information about how to register for these events. Also want to make sure that you know about our Learning Center. This is a virtual learning system. We offer free courses available to all healthcare providers. We know that you have very busy schedules, so we've tried to do these courses in bite-sized chunks. Some of them have continuing education credits. As an example, you could take a pretest and begin a lesson during a break at work. The next day you could continue the lesson because the system is going to ask you if you'd like to start where you left off. So it's not like you have to log on and complete everything all at once. The Learning Center is also mobile-friendly, so you could begin a course at work on your computer, and you could continue it later on your tablet or your phone at home, or even when you're out and about. Somebody wrote this part of the script for me, and it gives the example of while you're sitting waiting for your oil change. I actually kind of like that. Keep yourself busy. In order to keep everything on the Learning Center up to date and relevant, the courses are reviewed by subject matter experts. We also welcome your feedback, so if there's a course topic that you would like to see in the future, we have surveys on the Learning Center so that we can capture the requests for additional, updated, or new information. sorry, I lost my page here. Providers can expect to see courses sorted by healthcare setting, but I think I had one slide too soon. There we go. The courses are sorted by healthcare setting, but you are not restricted from any of the courses that are there except the ones that we use for our internal training. Managers can get reports on the courses their team is taking, the number of times the course has been taken. Managers can also look at pre- and post-test responses and grades and any relevant feedback that was captured. This can be helpful to identify gaps or opportunities for reinforcement of training. So we would really like you to visit the Learning Center and follow your healthcare settings instructions for creating a new account. When you log on, there'll be choices for hospital, nursing home, and I don't know if the other one is home care. So there are different ways that you can log on. If you have any questions about the Learning Center, you can send an email to learning@healthcentric.advisors.org for assistance.
And data from somewhere, but I came in like basically on the question. So I don't know what they really were talking about. Jane, hold on a minute. Excuse me, we're getting some background conversation. Please mute your line by pressing *6. Thank you. Go ahead, Janet.
And please don't forget to follow us on social media so that you can get any important alerts, news, and more. And because I did hear some comment there, was there a question from somebody? Are there any other questions? Well, if there are not any other questions, Jackie and I would like to thank you very much for joining us today. We hope that you have a great day. And again, I apologize if there was any background noise. Like I said, there was some type of an emergency outside of our building, and we had to relocate ourselves. And again, there may have been some noise that generally we would not have. Hope you all have a great day. Thank you.
Thank you.